Hello and welcome. I'm Jason Shire, a senior staff gastroenterologist with the Henry Ford Medical Group. Thank you for taking the time to learn about your colonoscopy. In this video, you will learn about the colonoscopy procedure, why it's important, and what you can expect. At Henry Ford, your safety is our top priority, and we are committed to providing you with the highest quality care. If you have any questions or concerns at the end of this video, please speak with your gastroenterologist office staff.
What is a colonoscopy? A colonoscopy is a check of the large intestine, or colon, with a lighted fiber optic camera called a colonoscope. A colonoscopy is performed for a number of reasons, the most common of which is to check for colon cancer. In fact, over the last several decades, colonoscopy has become the most important test to check for colon cancer. It allows us to check for abnormal growths called polyps, or even colon cancer itself. Colonoscopies are useful in helping your doctor evaluate your GI symptoms and find a therapy that works for you. Preparation. Preparation, or PrEP, is a key part of colonoscopy. It is important that your colon is clean enough to look for very small findings. There are many options for PrEP. Your doctor will recommend the best PrEP for you, and you will receive directions. Please be sure to follow these directions exactly. You can also find other videos provided by Henry Ford that explain specific bowel prep. Sedation. Once again, your safety and comfort are our priority. You should expect to be lightly sedated for the procedure. This prevents you from experiencing any discomfort or pain. Many people will sleep through the exam. The sedation will help with the accuracy and safety of the test. However, the sedation makes it unsafe for you to drive afterwards. We require that you have someone with you that can drive you home after the procedure. The procedure. It is expected that you arrive 1 hour before your colonoscopy procedure time. You will be in the endoscopy suite for at least 2 hours. The person driving you home needs to stay in the building during this time. At arrival, you will have a brief conversation with a nurse to review your current state of health and review your medicines. An IV will be placed into a vein so you can receive medicine and hydration. You will also be asked to sign a consent form that gives your doctor permission to perform the colonoscopy. Next, you will be brought into a procedure room where the colonoscopy is performed. This is where a mild sedative will be given. During the procedure, the doctor will insert the colonoscope into your rectum and maneuver it gently and safely through your colon. If precancerous polyps are found, they will be removed during the procedure. Post-procedure. Once the exam is complete, you will be brought to the recovery area to rest until your sedation wears off. Once you are awake, your doctor will explain the results of the colonoscopy. If a biopsy is performed or a polyp removed, you can expect those results in a couple of weeks. Your doctor will recommend when to have your next colonoscopy. Some patients may experience some mild cramping or bloating after the exam. This is normal and usually goes away in a day or less.
Remember, a colonoscopy is safe and effective. It's recommended for nearly all people 45 to 50 years old or older because of its ability to find and remove suspicious growths. Early detection is the key. Thank you for your time, and thank you for choosing Henry Ford.